is Bridget Kelly. I'm a physician assistant here at Aesthetic Enhancements with Dr. Armando Soto. Today we're going to talk about something that's a common concern during summertime once we go into those fitting rooms and start trying on shorts and bathing suits, and that is spider veins. A lot of women come in and they're very self-conscious wearing shorts or shorter dresses because they feel like the veins on their legs are very obvious. Sometimes they look a little bit like bruises, sometimes more like the little purple spider veins. So that's something that's actually very easily taken care of. The preferred treatment that I like to use, and I think most people do, is sclerotherapy. What is sclerotherapy? Sclerotherapy are those little injections right into the vessels that actually help to irritate the lining of the vessel and close it off. So once that vessel is closed off, basically your body reabsorbs it just like it would a bruise. So it works over about a 2-week to 3-month period of time, but it's very non-invasive. It's a small little needle that's not very uncomfortable at all. After the treatment, we put some compression on the area, so patients do have to wear compression hose for a week following the treatment. But other than that, I mean, you can go about your normal activities, especially after the first 48 hours, as long as you're wearing those hose during the day. The other thing we recommend is that people stay out of the sun, because one of the common complications or side effects with sclerotherapy is a little bit of a darkening of the skin, and that's going to be more common if you have the treatment and go out and have sun exposure while it's still irritated. There are other treatments available. One of those is laser treatment to the vessels. I personally feel from my experience that the sclerotherapy actually works a lot better and is less painful. So if my patients come in and they're completely, needle phobic and they just don't want injections, then the laser is a consideration. But if they're afraid that the needle's gonna hurt, I always tell them that the laser actually hurts a lot more, and there's more risk of blistering or hyperpigmentation with a laser treatment. So I still feel like sclerotherapy is definitely the gold standard treatment for those medium to small sized vessels. Now, if someone's having the thicker varicose veins, ropey veins, they're having a lot of pain or swelling in their legs, those patients I do refer usually to a vein or vascular specialist, because those are people who may have a medical condition that's going to need a little bit more invasive of a treatment and could also be covered by their medical insurance. So it's better to get that checked out first, and then if you have a cosmetic issue remaining after treating those larger vessels, then that's something that can be addressed. So again, I think that the treatment for the spider veins is fairly easy and non-invasive. It's also not very expensive, usually ranging anywhere from $125 to $250 a treatment. A lot of our patients may require multiple treatments if they want to get to the point where they have no vessels. And a lot of times people do require a little bit of maintenance. So maybe once a year you come in and touch up any new vessels that have formed. Because once we're prone to those veins, we're always going to be, the ones that we take away should stay away, but you can always develop new ones. So once you get through the first few treatments, then doing a little maintenance or touch up once or twice, or once a year or once every other year is usually sufficient and keeps our legs looking nice and ready for that beach weather.